Mumbai is a bustling city in India that has long been a hub for migrants seeking better living conditions. Over the year, a significant portion of the city's population has been made up of migrants from around the world, from countries such as China, Bangladesh, the Philippines, Mexico, and France. However, the challenges faced by migrants in Mumbai are many. Biggest, accessing adequate healthcare. Many migrants in Mumbai are living in slums or informal settlements where access is limited. They often lack health insurance and cannot afford private healthcare, making it difficult for them to receive essential medical care. Additionally, language barriers and cultural differences can complicate healthcare access for migrants, as healthcare providers may not be equipped to communicate effectively with these patients. Despite these challenges, efforts are being made to improve healthcare access. Mobile clinics, telemedicine, and community health workers are being used to provide healthcare services to migrants. However, there is still much work to be done to ensure they have access to quality healthcare services. In order to address these issues, we plan on implementing MumbAI, an artificial intelligence-based system with 3 facets to identify, connect with, and serve at-risk immigrant populations in Mumbai. First, our model will use existing demographic data from state government to create target areas of both increased immigrant settlement and underconsumption of healthcare. The mobile clinic will gather relevant health information from patients in multiple languages, analyze the responses, create personalized resource checklists for healthcare workers, generate after-visit summaries, and connect patients to nearby healthcare facilities through an asset map. The mobile clinic will also partner with a local telehealth company to provide after-visit support if there are any complications, ultimately improving the health outcomes of individuals and communities in underserved areas.
Before interventions and strategies can be implemented, we need to create a health status assessment to improve resource allocation. This assessment will be generated by artificial intelligence using demographic data, health records, and medical history. This includes identifying prevalent diseases, chronic conditions, and risk factors. The AI will then use this baseline health status to identify geographic areas with poor health outcomes, using data from populations and how much healthcare they are consuming. We can then find at-risk areas and keep track of non-communicable disease trends. We will combine this map with one that shows areas with a lot of migrants settling. And because Mumbai is such a big hub for transnational immigration, we need to identify the unique challenges, demographic traits, and geographic areas for international migration. We will then use AI analysis of data from both immigration and medical records to identify key geographic areas for investment. This technique is known as health geomatics and will create a map where we can then establish areas with poor access to migrant specialized healthcare facilities. We can use this map for resource allocation. For this, we will use an existing AI model as it is cheaper than creating a brand new one.
We have developed a comprehensive plan that focuses on raising awareness of existing mobile clinics among at-risk populations in the community. To achieve this, we have allocated $5,000 towards targeted advertising campaigns. By investing in these advertising efforts, we aim to ensure that individuals who are most in need of healthcare are fully informed about the available resources. This strategic investment will significantly contribute to bridging the gap in healthcare accessibility. In addition, we are equipping each of our 30 pilot clinics with 2 iPads connected to government hotspots. This initiative will enable patients to complete a thorough pre-screen survey, which will provide valuable information to clinic staff before their visit. We plan to then integrate the results of this survey with an asset map, which will be later used for their follow-up care. The combination of our AI database and the asset map will enable us to create an after-visit summary for our patients.
The asset map is a comprehensive directory of clinics, hospitals, providers, and other relevant resources in the community. We are empowering both healthcare workers and patients to identify the necessary resources for follow-up care. This map encompasses a wide range of data, including information on individual stakeholders, existing health associations, cultural considerations, relevant institutions, and the health economy. By leveraging on this extensive database, we can effectively promote existing resources while implementing necessary changes to the healthcare system in Mumbai.
In this effort, the proposed use of an AI-powered mobile clinic will provide efficient and effective healthcare services to patients. The patient will be greeted with our trained healthcare worker who will assist them in completing a survey. The survey will be designed to gather relevant healthcare information from the patient, including their symptoms, medical history, and resources they may need. The survey will be available in multiple languages, including Marathi, Hindi, English, Gujarati, to ensure the patient are comfortable communicating in their preferred language. The survey response will be analyzed by the AI, which will identify key phrases and keywords that will assist the healthcare worker in understanding the patient's needs. The AI will also use this information to create a personalized checkoff list for resources that the healthcare worker can provide to the patient. This list may include medication, referrals to specialists, and other resources that can help the patient manage their condition. For example, the AI can be used to answer patient questions about their health condition, medication, and treatment. This can help the patient feel more informed and confident about their care. AI can be used to translate medical terminology into plain language that the patient can understand. This can help the patient feel less overwhelmed by medical jargon and make it sense for them to follow their healthcare provider's instructions. Lastly, the AI can be used to provide patients with information about resources that can help them manage their health condition. This may include information about support groups, online resources, and finance assistance programs. At the consultation, the AI can be used to provide real-time information and support to healthcare providers and the patient. For example, the AI can be used to identify potential drug interactions, to provide information and treatment options, and answer patient questions. Once that consultation is complete, the AI will generate an after-visit summary that will be relevant to the patient's condition. This summary will include details such as the patient's symptoms, recommended treatment plan, and a list of doctors and hospitals that the patient may need to visit for further care. The AI will connect to the asset map, which will help the patient locate nearby healthcare facilities. We will also partner with a local telehealth company, Health Tech India, that will provide after-visit support if there are any complications. Overall, the AI-powered mobile clinic will help improve healthcare access and delivery in underserved areas by providing efficient and personalized healthcare services to patients.
Beginning of November 2023 to December 2023, we will connect with related state government agencies to collect data. January 24 to March 24, we will analyze that data that we collected. From March 2024 to July 24, we will work with developer to create the app. Beginning of August, we will start setting up the clinic. September 24, we will start training healthcare worker on site. It is really important to allocate the time and walk healthcare provider through the process of how the system works so they can best assist the patient and utilize these resources to its fullest benefit. In January 2025, we will check back in for maintenance and resolve problems that arise as they move into the new technology. We will spend $5,000 on advertising about the free mobile clinics. We'll spend $39,000 for the equipment. We will spend $60,000 on app development. According to Indian app developer, it costs about $20,000 to $60,000 to develop the health tech app. In this project, we will dedicate the max, which is $60,000, developing the app to ensure the quality and service of it. We also want this app to have multiple functions, so we want to ensure enough funding for it. For the remaining balance, we have $69,000 left. This money will go towards maintenance and solve any problem that arise.
In conclusion, the proposed AI-powered mobile clinic, MumbAI, presents a promising solution to address the healthcare challenges faced by migrants in Mumbai. By leveraging AI technology, the mobile clinic can efficiently gather health information, provide personalized resources, generate after-visit summaries for patients. The use of multiple languages ensures effective communication, while the asset map connects patients to nearby healthcare facilities. However, it is crucial to consider the ethical considerations such as privacy, informed consent, cultural sensitivity, transparency, equity, and continuity of care. By implementing MumbAI, we can improve healthcare access, bridge gaps in service delivery, and ultimately enhance the well-being of migrant populations in Mumbai.